See what happens if persistent and recurrent seizures are not treated. Seizures after 1 year of treatment are considered resistive epilepsy. When not treated early, a person who has persistent, recurrent epileptic seizures has frequent electrical leaks in their brain, and the structure of the brain may deteriorate over time. Noting that 70% of epilepsy patients respond positively to drug therapy, neurologist Professor Dr. Sultan Talachi shared details about epilepsy and epilepsy surgery.
1.
See what happens if persistent and recurrent seizures are not treated. AD pointed out. Dr. Sultan Talachi said the human brain works continuously and in an orderly fashion. Because of its structure, it can be said that it is bioelectrical. In the brain, which works in a systematic order, there may sometimes be cases where infiltration or parasites occur. If these parasites cross the threshold of epilepsy, appearance occurs, and there are some of the factors that cause its occurrence.
2.
See what happens if persistent and recurrent seizures are not treated. AD pointed out. Dr. Sultan Talachi said, in which area of the brain this electrical leak is located, the appearance of epilepsy appears to be related to the functions of that area. For example, if it is related to vision, there may be a problem with the image in front of that eye, flying butterflies, or similar vision.
3.
See what happens if persistent and recurrent seizures are not treated. The professor, Dr. Sultan Talachi said these electrical leaks can spread to the entire brain. If it spreads to the whole brain, a major seizure occurs. The body of a person with a major epileptic seizure shrinks uncontrollably, loss of consciousness develops, and in general, conditions such as breathing occur. Accelerated, wheezing and bruising, incontinence, biting of the tongue.
4.
Short-term immersion and separation may also occur. AD pointed out. Dr. Sultan Talachi said, each seizure may not occur in the form of fainting or convulsions. Epilepsy may also bring about a short-term immersion experience and eye drop, and sometimes forgetfulness without reason.
5.
Seizures persist despite medication in resistant epilepsy. AD confirmed. Doctor, if a patient still has seizures despite using 2 or more drugs in high and appropriate doses for a year, this is considered drug-resistant epilepsy, Sultan Talachi said. Overall, 70% of epilepsy patients respond positively to drug treatment. There is drug resistance of 30%. Epileptic seizures affecting the temporal and temporal region of the brain in particular are candidates for resistance.
6.
The patient's history should be carefully listened to. How a patient with epilepsy responds to treatment can be predicted by the doctor before using the drug, the professor said. Dr. Sultan Talachi said.
7.
See what happens if persistent and recurrent seizures are not treated. For example, a patient with temporal brain epilepsy, which is a severe case, is considered a treatment-resistant type of seizure. Such cases, if their conditions permit, can be controlled by epilepsy surgery. This may require further research in order to find out where the defect is located. Functional brain tests called EEG during sleep, positron emission tomography, or SPECT, may be performed on the patient. 8. See what happens if persistent and recurrent seizures are not treated. An EEG test does not always support a diagnosis of epilepsy. The diagnosis should not be made until the patient's history has been well heard. Sometimes seizures originate very deep in the brain. Because the EEG is made from the scalp, it may not be possible to detect electrical leaks originating from deep within the brain. 9. Can the frequency of seizures be controlled with medication? AD said. Dr. Sultan Talachi said the use of medication is to control the frequency of seizures. When choosing a medication, the patient's age, gender, whether the patient is of childbearing age, a child is examined if he or she wants a seizure, the type of seizure he has, and the treatment is chosen of drug use according to these criteria. 10. Brain structure can be disrupted. AD confirmed. Dr. Sultan Talachi said, when intervention is not done early, the brain of a person who has persistent seizures suffers frequent electrical leaks and the brain structure may deteriorate over time. This time, the disease cannot be treated with medication or surgery, or it becomes more resistant.